Welcome to the Dog Classroom.
The Dog Classroom podcast. I am your co-host, Anne-Marie.
And I'm your co-host, Amelia.
Like and subscribe
on Spotify and YouTube in video format. And now into the episode.
Here we go. Welcome back, everybody. So here we go with Dr. Jessica Panontin again for our podcasts. So usually once we sort of nab her for one, we got to try and get two in there. And then maybe down the road, she's looking at me and go, oh, geez, what else are we going to talk about? But this lady is full of information. So we'll see how much we can get out of her here. So this is one that I wanted to talk about, and I would love the assistance of a well-educated veterinarian to help me out with it a little bit, because even in training classes, there's a lot of questions, because in other podcasts, we've talked about how much Thunder Bay is of word of mouth. Right? Where, like, I don't want to say advertising, but, you know, like they'll come in and so-and-so said to me at the dog park, and you're just like, okay. Or I Googled this and you're like, don't do that, right? So the thing is, so we have the professional here to sort of get rid of some myths and talk about some stuff.
All right.
Other thing is, we're going to talk about these things, but then I'm also offering pet first aid. Again, so if you wanted sort of more in-depth and hands-on, because we're not going to talk necessarily about like bandaging and CPR, and I want us to sort of talk about more your feelings about different products and different reasons to come into the vet, because I think that's people, I don't want to say, you have the people that call, and you know this, like every little thing.
Yep.
And then you have sometimes the extreme of people that don't call at all.
They don't know when to.
Yeah, they don't know when to, yeah.
For sure.
So I thought it would be a good idea to sort of, you know, work through some of that.
Sure. So
people can definitely sort of get the information from a good source.
all right.
Right? So the one thing when with Dr. Panontin is we do have reps and stuff that come to the clinic to teach about medication, but I think it's also self-education, right? Like you're researching, like obviously you're not going to prescribe something if you don't believe in it.
Of
but
course,
when we're talking about different medications and new things, how do you sort of work through that or get comfortable with it?
I guess the question depends on what kind of medications we're talking about. So, I mean, sometimes certain medications will only come up because I'm looking to treat a certain disease, or there's something that I want to try differently, or that I think we need something better. So, or there's something that comes up like a disease that I haven't seen before and I need to, experiment. So, yeah, I mean, in terms of medications and why I choose what I choose and what I prescribe, there's lots of different reasons.
So it's almost like sometimes it's self-education because you're looking for a different product, but then it's sometimes like the drug reps or...
Yeah, and I mean, drug reps plant the seed, especially when it comes to certain like flea and tick medication.
Right.
They will be coming around every spring to tell us what's new and what there is out there. But, when it comes to those sort of medications, we want to look at what is in Thunder Bay. What do we have that we need to prevent or treat? The ease of getting things into your animal. So what form? And yeah, so basically we're looking, we're not just looking at the drug rep and saying, oh, you're going to offer me this, and yeah, that's the one I'm going to take. We're going to look at it deeper.
Right. Okay. So more like area based. Yeah. Okay. So on that note, I want us just to, in a little bit of detail because of springtime, and I'm concerned about it as well as ticks. So over the last few years, we've definitely had an increase.
Yeah, so
right?
ticks have definitely gotten worse in the Thunder Bay area. Lyme disease goes along with that. So we are seeing more cases of Lyme disease than we have before. And I think it's going to just continue to get worse as the years go by. So we will see more and more, and it will become more endemic in Thunder Bay. Right now, I feel like it's more pockets, but it'll change as time goes by and the ticks will spread. Most of the ticks, I shouldn't say most, I mean, I don't have the numbers on that, but we see a lot of the dog ticks, but there's definitely more deer ticks coming out in more areas. So,
Okay.
yeah.
Some people have said to me that their animal has the Lyme vaccine. Do you think they should still put, talk about what medications they have for ticks?
So, and people always say that too. So, I do the Lyme vaccine. Why do I need to use tick meds? Well, it depends. So, I mean, the Lyme vaccine is only helping to prevent Lyme disease if your dog gets bit by a Lyme positive tick. Okay. So if you are looking at, and there are other tick-borne diseases other than Lyme, we don't see them much in Thunder Bay, but we also get reactions from tick bites, and people just don't like ticks. Like they don't want them. They don't like them.
Yeah.
So there's other reasons to have tick meds because your Lyme vaccine is not going to stop a tick from biting your dog. So in terms of options, we've got oral and topical options for tick meds. So oral ones that we tend to use at the clinic, and that's just our personal preference. Again, because we looked at what they will kill and their efficiency, and that would be Simparica, which is just fleas and ticks, and then the Simparica Trio. And we chose Trio because it does have some hookworm.
Which we're seeing more of.
Yeah, well,
Right, yeah.
exactly. And we do see northern hookworm that some places don't see. So we wanted to make sure we could cover for all of these internal parasites as well. So so those would be kind of your oral options. There are other ones out there that last longer than 1 month because these are 1 month oral tick meds. But again, we found that the monthly option, we don't see that breakthrough where you have ticks at the end of the 3 month period biting the dogs. The other thing to point with oral meds is they need to bite to be efficient. So they do need to bite the dog to die, essentially.
Yeah.
But you should not see an engorged tick on your pet. The other option would be topicals. So Advantix, for example, would be an option of a topical med that does have some repellent effects. So it might repel those ticks from biting, but also should kill once they've bitten the dog as well.
Yeah.
So those are your oral and your topical options.
Right. So you're not going to find a live tick if you find a tick, it's going to be dead because it.
So if you have the Advantix, you should be less likely, but not every product is 100%.
Right.
Mm-hmm. And a lot of people will say, oh, I found like for where they're using the Simparica, the oral option, and they're like, oh, I found a tick on my dog. It was crawling around. Well, yeah, you'll see that because they don't die until they actually bite. So you can see a live tick. It's not because the meds aren't working, just because they haven't bit yet.
Yeah.
And it's just another reason to try to check your dog. So you can have all the meds, you can have all the vaccines. The gold standard still is you should check the dog, check around their ears, their face, because that's where they're most likely to get bit by a tick, under their ears. And
how come there?
That's just where their face is to the ground. So that's where they're more likely.
Does. Yeah. So
and
the
ticks will migrate up to the head too.
Right.
So that's their choice. So you can find them anywhere, but the head's going to be the place where you're.
Because they don't want to wander all the way to the back of the dog.
Yeah.
Ish.
Yeah.
Yeah.
That's not where they're going to attach.
Okay. I giggle a little bit about this because I can just see the expression of some people with ticks. So we're talking about the products. But I always tell people, like in their first aid kit or if they're going camping, that sort of thing, to also have like a tick twister. I'm sorry, I'm putting my hand. This is what. Yeah. Okay.
This is tick twister.
You know exactly what I mean. I
Universal
just
sign for tick twister.
Yeah. So tick twister. So basically, what you do is, you just sort of put it on the base of your skin, and you're going to rotate and pull it off.
Yeah.
Always have one in the training space.
Yeah.
I have to say, usually once a week, I'm pulling a tick off of a dog that people aren't aware of. And I think the reason why that we're using more tick meds, I think for myself, is I'm worried that one of those bites will eventually be like a Lyme disease tick. Yeah. So I don't want them to be able to have that blood meal. So explain a little bit how, just break it down for one more minute here, how if a tick has Lyme disease, how is it transmitted to the dog?
So they do need to be attached and have a blood meal. And now you're going to quiz me on the length of time that it needs to be attached. But they do need to be attached for a length of time. So it's not instantaneous.
Yeah.
The point is that the meds will kill before that period of time hits.
So they're way less likely to transmit it because that tick already had the blood meal and they die.
They don't have a chance to have a blood meal.
They don't have a chance.
They are killed before that happens.
Right.
So.
Okay. Perfect. So, but the other thing is, again, removing them, right? I know in the past I've removed it and dropped it. Then I had to find the little guy again, which sends everybody all squirrely.
Yeah, there's a tick loose.
Yes, exactly. And those suckers can move fast. So the thing with that is, I know I always used to say to people to bring them to the health unit. But I don't know. Do you know if they're still doing that? I don't think they are, right?
You know what? I don't know. And now is probably not the time of year. So I think when it gets closer. So
yeah.
And I guess that's a little peg to, when should we start our tick meds?
Yeah.
So, and that's when it'd probably be closer to April. It's been April the last couple of years where the weather has been consistently above 4 degrees Celsius. So that's when the ticks are going to start to move. So, so come springtime, we'll probably see if the health unit's going to take. I think with COVID, they were not accepting ticks for a period of time, so I'm not sure right now. But they might be back at it because it does give them a lot of information, knowing where these ticks are coming from.
Different studies and stuff.
Exactly.
Yeah.
And if they do carry Lyme or not.
Yeah.
So.
Yeah, because I think they were having somebody from LU, because I don't think Dr. Deacon is as involved anymore, as someone identifying the species. But I'm not exactly sure if they're being sent to actually check if they have the Lyme disease.
So
but like you said, things have changed a little bit. Yeah. Okay, so let's switch over. So we're talking about ticks. I think fleas is going to be probably a quick conversation.
Yeah, we don't see tons of fleas in Thunder Bay. They're there, but we don't see tons. And because of our environment, they don't live in the household like they will in some places, where it's a little bit more moist and warm. So we're lucky that our environment isn't one that harbors fleas. But fleas, again, in some places could be hard to treat, a little bit easier in Thunder Bay where we can get them on meds, and usually doing that for a couple of months in a row. Cleaning the environment is enough to get a flea problem under control. Yeah,
to get rid of it. Because I just remember I had one couple that went to Texas and they put the dog on flea meds like 12 months of the year or whatever. But I just remember her saying you would go outside with the dog and the dog would literally have come back in with 6 to 10 fleas. Yeah.
And that's just again, not a big issue in Thunder Bay.
Yeah.
So we see them, but it's not something that's a problem. And if we see them, we treat them, and
it's quite easily treated. Yeah. Okay. Another little critter, heartworm.
Heartworm, again, in Thunder Bay is not a big concern as it is where it's warmer. So heartworm is transmitted by mosquitoes, and they need to have 2 life cycles to keep that heartworm, basically the cycle going. So because our summers are shorter, we don't have that problem. It could change any year though, and if it does change, we might start seeing more heartworm. The bigger issue we have would be animals coming from other places, like in the States, the ones that go to Texas, and they might get heartworm down there and then come into Thunder Bay. So we never have no risk because of people who travel.
Okay.
But the risk is still low for us to, again, harbor heartworm in Thunder Bay for a long period of time.
So, okay, let me ask the question that I think some people will be thinking. And not maybe totally understanding the cycle. So if that dog comes from Texas with heartworm, gets bit by a mosquito, so then that mosquito now has blood that has heartworm in it. Can it be transmitted to a dog in Thunder Bay?
Technically, if it goes through the life cycle, it could be. Is that a high risk? No, but it's possible.
Yeah, it's possible. Okay. Because the other thing with heartworm is we've seen a few rescue dogs come from Dominion Republic, I think.
Yeah, basically anywhere warm is
warm south,
exactly. is a risk. And we've had some come up and be positive for heartworm and have to go through treatment for that.
Yeah. So what is treatment? Just describe it quickly for me.
Treatment is a series of very painful injections, basically. So it's not nice. And if we could prevent that, obviously, that's the best case.
Yeah, the best case, instead of having to...
painful, and also, there is a risk of even death going through the treatment. So it's not nice. We don't want to go there if we can avoid it.
If we can avoid it, for sure. Okay, so we talked about those main 3 critters. Okay, now another thing a lot more people are seeing, and I think, again, I don't want to say word of mouth, because, Thunder Bay, word of mouth, everybody, likes to chit chat and give their opinion. Because, I'll have some, again, people come in, puppy school, be asking questions, and like allergies is huge.
All of the itchy dogs.
Yeah. And then there's the whole go to the pet store and like how many different brands of foods. And again, what actually that reminds me, maybe I should ask now, would love to do one day a nutrition talk, because there's so much unregulated information. Anyway.
Yeah, there's tons of information.
Yeah, so I don't want to get off topic, because, we could just go like that for a few hours. So
what we're talking about allergies, I would say if I went and looked at all of the times I've talked about allergies in the appointment, I think that's like the number one problem that we discuss.
Okay.
There's almost every dog to some degree. We talk about itchiness or allergies or food intolerances or whatnot. But so I mean, there's lots of misinformation in terms of, again, when we talk about diet, like grain-free, not grain-free, and all that kind of stuff. But when it comes down to allergies, every dog's different, just like ourselves, and we could be allergic to anything. Tends to be a protein source, would be your more common food allergies. And what's the number one protein you're going to find in a dog food?
Chicken.
Chicken, exactly.
Yeah.
So not that every dog has a chicken allergy, but that's the most common protein you're going to find. So right off the bat, when we're talking about allergies, we always say, okay, well, avoid chicken, avoid beef, because they're your number one proteins you're going to find, and try to find something novel. And then it gets hard because they're like, oh yeah, well, my dog was on a can of beef and lamb and chicken and turkey and all of those foods all in one. And I'm like, okay, that's great. Now let's avoid all those. So allergies, food allergies, trying to find a novel protein source to see if we can help. Problem is dogs can also have environmental allergies. Yeah. So, and we see a lot of that, come springtime, when we see the itchy ears, chewing at their feet and their bum and all that kind of stuff. Seasonal allergies are a lot harder to diagnose than food allergies. Food allergies, you can do a diet trial. If it works, great. And if it doesn't, then, that's our test. But environmental allergies are going to be harder to test. There are blood tests out there to test for environmental allergies. They, I guess, give you information. So yeah, my dog.
It's nothing like really cut and dry then?
No, so you can, and people who do this online, like there's a lot of things even available to owners now. You don't even have to go to your vet. You can go Google it and say,
and then
do a swab, do a fur pluck or whatever, and they can give you all this DNA information. But what do you do with that?
Yeah.
So you have this information. That's great.
Yeah.
So your dog is allergic to all of these pollens and molds. There's no, then what do you do?
Yeah, I know.
So I mean, in some ways it's great to know, this season, my dog's likely going to have an ear infection. Great. So now you got to treat that ear infection though. So we need to find some medications or some options to treat the ear infection. So that's allergies in a nutshell. In a nutshell. I could keep talking about allergies.
I know you could. So a few questions I've been asked. And I've heard you guys have said this, vets have said this, that younger dogs are usually less prone.
No. So, younger dogs, a dog can get allergies at any age of life, any stage, any age.
Because I was thinking more when I would hear you guys sometimes, and again, this can be...
But you're probably thinking more in terms of environmental allergies.
Okay.
So the first year of life, if a dog is itchy, more likely food. So, itchy puppies come in, that's where I'm more likely going to say that, that diet change. the seasonal allergies are, again, middle-aged dogs. And then for some reason, those senior dogs, it goes back to food allergies being more likely.
How come, you think?
Not sure.
Not sure, eh?
That's just the trends of what you see. But it doesn't mean that they can't have food allergies and environmental allergies. And it doesn't mean an old dog can't, get seasonal ear infections too. So allergies are the most frustrating thing for a vet to deal with and for
the owners as well. Yeah. Because I think the thing is, and then we had talked about in our last podcast, we were talking about an exam and visits and stuff and ask questions.
Yes.
I just want to refer to that for a second, because there are different issues that dogs can get. And I would say allergies is one of them that I don't want to say the majority of time. I wouldn't even say the majority. But if you have one exam, go see you for one exam, go home, worked maybe a little bit, didn't work. Well, that's it. It's over. Mm-hmm. It's something that you may have to go back to see you multiple times. Yeah. So
ear infections being,
same
that
thing,
prime example. So, the ear infections are not usually just you treat it one and it's done. A lot of people will come back and like, oh, I was here, 2 months ago and we had an ear infection and it didn't go away. And well, did it go away? But it came back. So, basically trying to find a treatment plan with your vet.
And then those follow-ups, again, are building
a relationship.
Definitely, but working through like the different levels, because, I'm not going to walk in and my dog just got allergies and you're going to throw 3 different medications at me and you're going to do all this. Mm-hmm. I think, the practical part is you try and treat the most obvious. And then obviously if you have to build deeper and deeper and deeper, then you do.
Yeah. And I mean, I guess if you're referring back to, having a relationship with your vet and your vet knowing your dog and knowing what meds they were on and knowing
what has been tried
and hasn't been tried.
Yeah.
Sometimes it's hard to walk into a room when you haven't seen the dog before and they're like, oh, well, maybe we'll try some Apoquel this time. And they're like, oh yeah, the last vet did that and it did nothing. It's like, okay, well, maybe we'll try Cytopoint this time. Oh yeah, we did that and it did nothing. Okay, so let's start from the beginning.
Yeah, because definitely, those cases are cases in general. Like you said, you have to build on it, and it may take multiple appointments in order to do that.
What's going on.
Yeah, to figure out what's going on. So, like I said, as far as first aid, let's just talk about a few things. So you mentioned, again, in the last episode, you had 2 emergencies come in, right? So what are, say, some of the more, I don't want to say common again, but more of the emergencies or something that you would see springtime-ish?
Springtime. Well, I look down on your sheet and
know.
I see porcupines. So porcupine quills.
Yeah.
I mean, obviously very common spring, summer, even fall emergency. And I mean, I guess points on quills, like what can you do? Don't cut the quills.
Yeah, I always go right there first.
What don't you do? Don't cut the quills.
Yeah.
I guess a very old wives' tale is to cut the quills. I don't even know why.
Because apparently they're filled with air. And they deflate and fall out.
But they don't. It makes it so much harder to pull the quills when they're cut. Also, quills get mushy if they sit there for a long time. So some people, their dog, and I'm not saying everybody needs to come in at 2:00 in the morning to get the quills pulled. But yeah, if your dog gets quilled at 2 in the morning and then you waited till like the next evening to pull them out, they're going to be mushy and it's the everything's inflamed and it's not great. So it's better to pull full quills in a timely manner, basically.
Yeah. And it is people don't realize how painful it is.
Yeah.
Because you always get the phone call, can I just have some medication to give my dog so I can pull the quills at home?
And I don't, I don't recommend that.
Yeah.
One, because, well, I mean, there's some great dogs out there. I won't lie. Like when we were younger, in the country, we've had dogs where they're great golden retrievers and we pulled the quills and they were fine. Not every dog's going to let you do that.
But that was maybe if there was like 5 or 10.
And that's it too. Like there wasn't any in the mouth, down the tongue, in the throat.
In the shoulder.
In the shoulder. Yeah, exactly. In the shoulder, between the toes.
Yeah.
So again, there are some dogs where you can do that, but I wouldn't recommend it for majority of dogs. It is painful. They'll bite you. And the last thing we need is a dog biting their owner because they were trying to pull quills out of their mouth. So even I've got one dog that she was quilled and there was only like 4 in her muzzle, but she was the kind of dog where I was not trying that. She got all of the drugs and all of the pain meds because she was a wimp. And
she was not letting you do it.
No.
Okay.
No.
Any other thoughts about spring-ish?
Spring emergencies?
Yeah.
So, I mean, not emergency in my mind, but a lot of people feel as an emergency is, getting sprayed by a skunk.
Yes.
There's a great one.
Yeah.
So there's a lot of things you can Google where it says, being sprayed by a skunk is deadly and not great. And again, if a dog was sprayed directly in the mouth and they did not inhale any air, yes, there is a way that being sprayed by a skunk could be deadly. It is irritating if it's sprayed in the eyes, but I mean, I would say very unlikely is that being sprayed by a skunk deadly. So stop Googling and
bath.
And then look at,
Stop
and then
Googling.
Google the
Give them a
recipes
bath.
with Dawn dish soap and hydrogen peroxide and all those things on what to bathe your dog.
Yeah, I think the other thing though is experience a few years ago with Fisher is eyes are the main concern because I know he got bloodshot and
a lot of dogs will get goopy eyes afterwards and yes, that I can see, but yes, not necessarily respiratory distress, which was a big Google thing that I've definitely got a couple
to
calls.
actually inhale that.
Yeah.
They would have to be like right
there,
right in there,
not inhaling any air, just like a skunk.
Yeah, because what I've told people is, because unfortunately a few times I've been behind the dog when the dog was sprayed, but like the taste of it or smell is different at the beginning than it is later.
Well, I was going to say taste or smell. That brought up another ingesting it. So a lot of dogs will puke afterwards too.
Okay.
But I mean, that's self-limiting. They puke and they get over it.
Yeah.
But it can cause some GI upset. It can taste gross. They can drool, that kind of stuff. So
I think sort of we're going to wind down a little bit here, but what I hear a lot from clients is with springtime when the snow's starting to melt and all what word do I want to use? Stuff that comes out of the snow. The gross stuff that comes out of the snow. But I find, there can be a lot of vomiting and diarrhea.
Yeah. So, spring melt. So everything comes up with the spring melt.
And they eat it.
Yeah, exactly. Dogs eat it. Dogs drink the gross puddle water. And we do see a lot of GI upset. And depending on the dog, it might just be one episode or it might trigger
So maybe... episode. Summarize real quick is when should we be concerned about the GI upset?
So GI upset, I mean, diarrhea can take, like a small case of diarrhea can take a couple days to resolve. So if your dog's eating, drinking, and has some diarrhea, then I mean, after 3 days, if it's getting worse and not better, then contact your vet. It can take 3 to 5 days to get better, but yeah, if your dog's not feeling good, persistently vomiting, the diarrhea is getting, bloody and worse and not necessarily, starting to get soft and formed, then call your vet at any time. But a lot of dogs, young, healthy dogs, 3-5 days after,
they're getting over it.
They're starting to get better. So, and the thing is, a lot of people do call too at that day 3 and they come in on day 4 and they're like, oh wait, now they're getting better. And those are the easy appointments.
Where they're trying to feel better. I know a lot of people will get a little bit excited about self-medicating with them with Pepto and
a lot of times I don't recommend any meds because again, like ourselves, do we give ourselves Pepto every single time? We got to let our guts deal with some things. I mean, there is options. You can give Pepto, you can give gravel, you can give a lot of these things, but I mean, I guess I'm more in the school of probiotics would be the way I would go over a lot of those
because
meds.
That's sort of a new thing. But I think when Dr. Panontin says that, I honestly would still call the vet clinic and get a dose or an okay.
Exactly.
Yeah, there you go. Or a recommendation, whether you should give it. And again, the dose. Yes, it's online.
But again, most times you don't need it, and it's not recommended. And I'm kind of a, less is more person.
Yeah.
So, probiotics and bland diet go a long way.
Yeah. And usually that's what I don't want to say
recommend.
old school, but it's worked back then. So in summary, we actually, I think, had a pretty fun time talking about ticks. So we took up
Too much time.
We took up a bit of time talking about that. But honestly, people have lots and lots of questions. And even though there's, information posted and out there, I just really think they're, I don't want to say more willing, but, in having that discussion, because I'll find sometimes in dog classes, half the time we're talking about, ticks and fleas and, because maybe they forgot to ask at the visit or, and we remember things afterwards.
Or their visit was in, December, and then they don't think about it because it's springtime. And I mean, that's a problem. But I tell people when I do have visits too in the winter or fall, when we're not thinking about things, to call us. Call us in the spring. Talk to us about the ticks. Even the receptionist can go through a lot of these medications and options with you. So
and then, there are, I have to say the techs are quite well educated too. Just have to throw that in there.
I didn't talk enough about the techs, obviously. I know. The techs are busy. They don't want to answer your question.
They don't. But, there's definitely, if receptionists are busy or they don't have the education, the answer will be found.
Yes.
Let's say that. And there is quite educated staff to find.
Yes. And a lot of times those calls will go to the techs too, and they'll go over all the options that you have.
Yep, for sure. So thank you.
Well, thank you for having me.
Very much. It was awesome. And then I also got to steal some time to hang out with you a little bit. Just since I'm not at the clinic so much, I miss my hangout time there.
I miss you. I only see when your pets have issues. So.
I know, we won't say that. Yeah. We all know, they asked me, about whether I'm working, but I'm like, I do have 5 dogs and I have to keep on Dr. Panontin's good side. So, because, there might be weekly, bi-weekly texts and so forth happening. So
sometimes.
Yes, sometimes. So thank you very much. For hanging out with me and chit-chatting and sort of clarifying some of these things for our listeners. And again, I'm not going to forget about the nutrition one, everybody. So I have bugged her in the past about possibly even doing an online Zoom thing or something, because years ago, I'm going to go off tangent here for a second. Amelia can feel her in the back there, some looking at me, but in the past, Dr. Alderson, years and years ago, I think when I first started, did these nutrition seminars, and it's super hardcore when you get into percentages and stuff like that. But I think what people just really want is they want to be confident in walking into the pet store and being confident with picking something and just having that little bit of information. And, we've taken some courses with just reading pet labels and reading labels in general, actually, have to say, right?
Well, and this will translate into your daily life. You're looking at a pet food label is the same as looking at food labels in the grocery store. So,
that's actually true. And then, so basically, in just talking about labels in general with anything, because, there are tick meds and self products that you can get at the pet store, just be aware, research the brand a little bit, read the packaging, read it, right? And then, having the conversation with the vet is, I think, the best sort of the option with it, because trust me, everybody, they have the education.
Maybe a little bit.
Oh, they take the time for the education. And the thing is, and again, is, the more you deal with it, the better you get at it, right?
For sure.
Yeah. Okay. So thank you again, Dr. Panontin.
You're welcome.
For hanging out. And Amelia and I will let us know if there's any other topics that we can, or guests that we can actually bring on. We've met so many amazing people, just in my business and in the dog community and stuff. So it's really fun to share it with you and chit chat back and forth. So thank you, everybody, and stay tuned.